Hello, my name is Jill Berry Bowen, CEO of Northwestern Medical Center and your host of the NMC Health Beat Show, dedicated to discussing important healthcare topics of interest to our community. On today's show, I'll be talking about wonderful hospital budgets with our Chief Financial Officer at the hospital, Chris Hickey. Chris, thank you for joining me today.
Absolutely, I'm glad to be here.
I know we're just going to have an exciting discussion on budgets that's going to keep everybody just totally captivated.
It's always a riveting topic.
So before we get into budgets, maybe tell us a little bit about yourself,
Sure.
because you haven't been in the hospital that long.
Yep.
So maybe about yourself and a little bit about your background.
Sure. Well, I was very happy to be able to come here back in January of last year. So I'll be approaching a year come this January. I've got over 35 years of experience in healthcare, and many of those at the senior management level, both in New York State as well as in Massachusetts. So this is my first experience with a Vermont hospital, and it's pretty unique.
It is unique. We're going to talk about that uniqueness. Well, we're grateful to have you on board as well with all of your experience. So, and your readiness to kind of tackle
Sure.
the changes that are coming before us. So it's great to have you on board. So talk a little bit about how you develop a hospital budget. So
Yeah.
let's ground folks in maybe what's unique about a hospital budget and what the process you go through to develop one.
Sure. It's, the budget process is a fairly lengthy process. We start probably in February, looking for an approval sometime in September. So it's a pretty significant 9-month process that takes place. The most important part is really setting the tone by identifying what your volumes are going to be. How many people do you predict you're going to see over the course of a year? In each of the different disciplines, how many inpatients are you going to see? How many outpatients are you going to see? And we get right down to the granular level of every department, predicting what their volumes are going to be. So that kind of sets the base for establishing the rest of the budget, which the next part is really figuring out how many people you need. How many people do you need to produce that level of volume? How many nurses do you need? How many radiology techs do you need? And all the different positions in the hospital, we determine that based on the volumes that we have. So that kind of sets the tone for the basis of the budget. About 60% of our budget is people and the benefits associated with those people. So it's the biggest component of the budget. From there, we sit back and then determine what supplies we're going to need for the surgeries we do and the other supplies that we are, and other services that we provide. So that's kind of the basis for it. All looking for getting it ready for approval for both our board, our finance committee, and the Green Mountain Care Board.
Aha! The Green Mountain Care Board. So what is the Green Mountain Care Board and what role do they play in the budget process?
Well, the Green Mountain Care Board is a regulatory agency that is developed in the state. It's 5 members of the state who really have the responsibility to approve hospital budgets. So our responsibility is to prepare a budget that is reasonable and that meets the guidelines that are established by the Green Mountain Care Board. The most important one being identifying our revenues and the magnitude of revenues that we can support within the community.
Now talk a little bit about the revenues and the I guess the cap. Let's talk about the revenue cap.
Yeah. Well, the Green Mountain Care, the most significant issue that the Green Mountain Care Board regulates is that they cap the revenue growth of hospitals within the state. Most recently, the cap has been 3%, and then they add another 0.4% that allows us to invest back in the community and unique initiatives for healthy living and things like that. So they only allow us to grow from year to year by that 3.4%, those two components combined. And that's probably the biggest challenge that a lot of organizations have had, in particular NMC.
And so what are some of those challenges? I mean, how has that impacted putting the budget together? Have you made any changes, or I guess what has been the outcomes?
Yeah, I think the most difficult thing for us is we're continually looking for things that are needed in the community. What services are needed in the community? Continually looking for opportunities to make sure we have the right complement of medical staff and medical services to provide to the community. Two that we've brought on recently is dermatology and ophthalmology. Services that have really helped out the community.
Right.
The Green Mountain Care Board actually allows us an exception to that cap. When we bring on new physician services into our organization. The challenge that we have is that those services grow.
Right.
And, as they continue to ramp up and they get to be known in the community and they get to have a lot of referrals in the community, those services grow. But there isn't really any recognition in the CAP process to recognize that growth of physician practices.
So when you say the growth for our hospital, has the hospital grown, or has it really been more outpatient to serve the community? So where are you seeing the growth happening?
Yeah, as we developed the budget this year, when you look back over the last 10 or so years, the hospital's grown by about 1.1%. And
so that's
on
well
average,
underneath that cap.
Annually, well under the cap. What has grown is our outpatient services, and specifically our physician practice services. One big one that we took on this year was the pediatric practice. As of January of this
huge
year,
to keep
very
them in
large
the community.
Practice. Yeah, that's actually about over $3 million of our budget is the pediatric practice, and that. We're over $100 million budget, but that's significant. That's a pretty big number, a pretty big component of our budget.
It sure is, and so needed, in the community, as far as adding pediatrics and the other services to keep care local, to keep people healthy.
Absolutely.
So I think that's so important. So what happens when you are over the revenue cap? I mean, what's the reconciliation, or is there?
Well, a couple different things have happened over the last few years. Last year, before I got here, the organization was pretty significantly over the cap. Really we did two things. One is we had a rate reduction. We reduced our charges to actually recognize the fact that our revenue had grown to that point. The most unique part is we worked with the Green Mountain Care Board to allow us to take some of that money that we would have reduced our rates and be able to invest it in healthy communities and our initiatives associated with healthy communities. And I'm sure you've had a lot of people on this show associated with that, so I won't get into too much detail.
Absolutely. The community case management and the Rise Vermont and really helping people change their lifestyles to be healthy. You're right.
Yeah. Yeah, and that was $1.1 million, and we have made the commitment to continue to provide that within our budget structure. And it's probably one of our biggest challenges is making sure that that's sustainable. So we need to continue to work with the Green Mountain Care Board and others to make sure that that's sustainable, because that's the future of healthcare.
It sure is, and whereas we're closing out another year here, and we're over the revenue cap again, but we don't have any idea at this point how they're going to address that, correct?
Correct.
At this point?
Yeah, we're still, obviously our year end was September 30. We're still finalizing our year end financial statements, and I'm sure we'll be talking with the Green Mountain Care Board in relationship to how we'll work through our current cap, because we are over the cap.
So in our preparation for this upcoming budget, how has your thought process been different when we think about the ACOs and the looming all-payer waiver? So what do you forecast as far as budgeting going forward?
This particular year, because we are in such a state of flux in relationship to what the healthcare reimbursement environment is going to be in the next 5 years. There's a lot of regulation out there, and I don't want to get too technical on the show, but there's a lot of legislation that's been passed by the federal government, that is working to change the way hospitals are funded, to move it from a volume-driven service, fee-for-service structure to more of an outcome structure. And, and they're doing that to really try to get a control of the growth in healthcare costs, which we all know is significant to the community.
Absolutely. So when you think about the budget, you've talked about volumes and things. There must be a lot of significant purchases, like equipment. I mean, to keep a hospital. So how do you balance? So you've got the revenue cap, but you still have these expenses. You have you're paying professionals, and you have these capital needs. Yeah. So how do we balance that and still have a bottom line to reinvest?
Well, that is the importance of the bottom line. I mean, I think a lot of people over the years, I've been doing this for a long time, always say, well, wait a minute, you're not for profit. You shouldn't be having a profit, you're not for profit. The reality is hospitals have to have a profit, because what that does is it allows us to do what we're doing down the street right now. I mean, really investing in the services that we provide, investing in the equipment and the building that we have. So we have a capital budget outside of our operating budget. That capital budget is, again, a method of us sitting back and saying, okay, what needs to be done that is significant in nature? Something that's going to last us more than 3 years, and something that is going to cost more than we have a threshold of $2,000. And what that is we define that as capital. That's something that's going to be used year after year after year versus something that's going to be used in 1 year. So we do a full process of identifying, first of all, how much money do we have available to buy capital? And that's generated from our profit. It's generated from our operations, the majority of it. And then every now and then we actually have to borrow money. We borrowed money this past year in order for us to do our master facilities plan.
Right.
So those are significant pieces. But we have a multidisciplinary group that sits down annually, reviews all the particular requests that our department managers develop. So our department managers sit back and say, geez, what do I need? Do I have to replace that x-ray piece of equipment? Do I have to replace the boiler? We have to replace the roof? Surgical equipment, all of those things, and they're competing against each other, which sometimes becomes a challenge.
Sure.
And so we narrow that down. This year we had approximately $12 million of requests, forgetting our master facilities plan, because we really handle that separately.
Sure.
And we had about $6 million that we could approve. So it was we could approve about 50% of our requests, which, as you imagine, is very difficult to choose.
Wow. Big job juggling the priorities. So as we kind of close out our time here, I think, as people look around and kind of worry about healthcare and where it's going, the all-payer model is out there, and so how would you summarize what that means for us when we hear that term, or do we really know exactly?
Well, I think to the average citizen and to the community, it's really not going to mean anything. They're going to get the services that they need.
Excellent.
They're going to get them here locally at NMC. It adds a significant burden to us. Because the risk, what the government is trying to do is shift the risk from government and insurance to the healthcare providers. And that's probably the thing that keeps me up at night is, how do we take on that risk? NMC's prepared for it. I mean, they've worked hard over the last 10 years to really build resources that can be used to help us weather our involvement and our participation in risk throughout this process of changing the way healthcare is being reimbursed.
Yes, a lot of change, and I think you're right. We are prepared for it, but we have to be good stewards of our resources in order to have a long-term future, which we will.
Sure.
Here. So, lastly, you've got a big job. How do you balance? What do you do for fun? Because you got to be ready for this big budgeting process.
Well, I have family's really important to me. I have 4 children. I'm one of 9, so I have my wife is one of 7. We have an extremely large extended family, and that's how I balance. I balance the importance of being with my family when I need to be with my family, spending time with them, regardless of the time of year, whether it's summer or winter or anything else. I love the water. We boat a lot in the summer, and you got to become disconnected because these are overwhelming jobs, and if you can't separate yourself from that, it'll really eat you up. And you do a very good job of encouraging people to do that.
Trying. Get a role model, practice what you preach, right?
That's right.
So, thank you for doing that because it is about balance, and as we focus on the health of the community, we need to be a healthy organization.
Absolutely.
So thank you. Well, thank you so much for joining this show. The time flies when we're having so much fun talking about budgets. So.
Absolutely. Well, thanks for inviting me.
You bet. I'm Jill Berry Bowen, your host of the NMC Health Beat Show. It's been fun talking about budgets, and we are here to provide exceptional care for our community, and that means being good stewards of our financial resources.